Fletcher's Solicitors are proud to sponsor the Mama Academy podcast series. We are one of the UK's leading birth injury specialists, trusted by families with the most complex legal cases. We champion better maternity care through every family's story. Fletcher's Solicitors, for every birth, for every baby, for every family. For more information about how we can help, visit www.fletchersolicitors.co.uk.
Hello and welcome back to the Mama podcast and our special series for healthcare professionals. In this episode, Heidi is joined by Georgia Kontosorou, a midwife and maternity digital leader with more than 20 years experience across maternity services. Together, they explore why high-quality maternity data is so important for improving safety, where the current gaps are across NHS systems, and how better digital integration could help clinicians identify risk earlier and prevent harm. Here's Heidi and Georgina.
Well, welcome to this episode of the Mama podcast. I'm Heidi Eldridge, the founder and CEO of Mama Academy and the host for today. And I'm sitting here with Georgia. Thank you so much for joining us. Georgia, please can you introduce yourself and tell everybody who you are?
Hi Heidi, thank you for the invitation and I'm very happy to be here with you today. What I'm doing, I'm a midwife for the last 21 years. I've been in all the maternity services wards. I've done labour ward, high risk, low risk, different places within the maternity services. And the last 12, 13 years, I've been in digital midwifery landscape, I would say. I started as an organizational and trust level digital midwife. I moved to the ICB, and for a couple of years, I was also the co-chair for the Pan London Midwifery Digital and Data Expert Group. I have done some studies on the field, like I have an MS, a master's degree in health informatics, and I'm currently doing my PhD in digital leadership and policy making for digital nursing midwives.
Wow, okay.
And so here we are.
Yeah, you're doing lots of different things, It's really exciting. So today we're here to talk about data and data capturing. So why don't we start with why capturing, high quality data is so important, especially within maternity services?
High quality data, I would say, is the foundation of safe and equitable maternity care. It's what enables clinicians to spot deterioration early, recognize patterns across populations, step in before the harm occurs. So in maternity, where a birthing person's condition can change rapidly, real-time, accurate data acts as a crucial early warning system for both mothers and baby. So let's say good data turns raw numbers into meaningful insight that shapes staffing decisions, risk assessments, continuity models, and resource planning. When we don't have data that they are reliable, we lose opportunities for prevention and learning and improvement. So robust data is what allows to predict risk, intervene earlier, and build genuinely proactive approach to safety. I think that's the most important part.
Absolutely. You can recognize trends so much easier, can't you, when you have the right data? So what data do we currently have access to, and where are the gaps?
The UK holds several strong national data sets, like MSDS, we have MNSI, we have Embrace, PMRT. The quality and completeness vary significantly between trusts. That's the problem with this, where the gap is. So while we have good outcome reporting, we lack reliable process indicators, such as triage response times, escalation intervals, gross surveillance steps. We miss on how care was delivered. We know the outcome, but we lack in how we do things. Many trusts struggle with incomplete MSDS submissions, inconsistent data definitions, digital fragmentation across multiple EPR systems. So I think these are the limitations that we can, our ability to predict risk.
And speaking about the gaps, how does primary care link up with maternity services? What are the gaps there? Because I expect there's an issue in the primary care information talking to the maternity services.
Yes, unfortunately, there is a huge gap there. So primary care data sets, unfortunately, they're not easily accessible from the maternity services and vice versa. I think creating interoperable solutions there, it will bridge a huge gap and it will help all the trusts to build better services. For instance, what I mean, if we could see from the primary care data sets how many high risk cases we have, we could predict what the population we will need to serve and how the services needs to be built. But also sending the information, if we could exchange automated data from maternity services to GP and hubs and all the primary care services, they could have continuity in postnatal periods or even when subsequent pregnancy is there. So this is where maternity services and national strategies should focus a bit more.
And have you ever experienced a problem where you've been trying to access certain data and you haven't been able to? Because I know as a charity, that happens to me all the time. I might be looking up a particular region because I want to learn about their particular demographic, or it might be specific where I need to know about pregnant migrant women or pregnant women of a certain nationality or language, and the data is just not there. It's really, really hard. Have you experienced that?
I did experience that when I was working for the region for an ICB, and I had to say it was a laborious, it was a very constipated process, I would say. It had to take weeks and weeks to even build a pathway for us to get this data. And then we fall into the same gap that we collected retrospective data that they may have changed because people move within the regions, within, they move out of this area. So it created even more problems. So creating automated data capturing and exchange pathways that could link us, that talk to each other, I think this is where all this burden will be taken away.
Absolutely. And you've hit the nail on the head there, and the fact that there's no consistency. All the trusts are doing different things. How can there be better national oversight and monitoring of those processes and safety data, in addition to outcome data, such as MOS, for example? Because I know like the Saving Babies' Lives metrics, for example, in MSDS, obviously they've been developed to track if trusts are performing in line with the national guidance. But at the moment, many trusts aren't submitting these, or they're submitting sort of implausible data. And as they're unmonitored, those problems aren't being identified. I know of a case recently where it was within 40 trusts, actually. They were adopting an unsuitable fetal growth chart, which went against national guidance. And there was evidence showing that actually did lead to a significant increase in baby deaths. So I guess in terms of actually thinking about baby deaths, what can be done for more national oversight to ensure that that sort of thing doesn't happen?
And I would repeat the same. I would say national oversight of maternity safety can only work if we look at both what happens and how it happens. So as you mentioned, a good example is Saving Baby Lives process metrics in the maternity data set, the MSDS. So these were designed to tell us whether trusts are following national guidance. For instance, if they follow fetal growth surveillance, as you said. But many organizations either don't submit or submit implausible values. And that is because we lack routine national monitoring. And this is where we have to invest and develop our tool. So the lack of process oversight means this wasn't picked up early. If we had that in place, that would have been picked up, and then that would show the decision was associated with the increased baby deaths. So we need a tighter national approach, like a small set of essential Saving Baby Lives, for example, as you said, process fields, or MSDS data fields, standardized across the NHS, and a must-have a must-have characteristic of this data, that all providers should do that, and automated data quality checks that flag early concerns or flag gaps in recording those data. And a rapid response pathways similar to the ones used for MOS. So if we can combine our strong national reviews with better digital consistency in real-time maternity data, we'll be able to identify problems before outcomes deteriorate. I think this is where the real opportunity for SafeCare sits.
Yeah, absolutely. It needs to be mandatory. And this is something that we are feeding into the National Maternity Inquiry at the moment. That's what we're really calling for, that this data collection is mandatory. Also, I know recently data analysis from 2.5 million births was obtained from Embrace. And that actually showed that South Asian and Black women, they face significantly higher stillbirth risks after 39 weeks compared to white women. But even though that's critical information, it's not being communicated to affect clinical decision making. But that's because Embrace themselves don't have the resources to do that. And in other countries, they would bite their hands off to have that kind of data, and that's something that does already exist, which is amazing. So how can we persuade the government to invest in analysing data that already exists? So there's a mandatory call to have it collected, but then how can we get them to analyse it afterwards, because it's so important?
So important information within those data. So Embrace, as you mentioned, has already done the hard work. But right now, that insight stays in annual reports. Other countries would build national algorithms. This is what we need: national algorithms, national dashboards from this Embrace, risk-adjusted pathways from this kind of data sets. So what we need to do to persuade the government, I would say, is to shift the conversation from cost to value. So this isn't about collecting anything new. The NHS already collects the data, meaning the return on investment is exceptionally high. So we haven't funded the last mile. Secondly, inequalities are costing the system far more. They spend in investigations, litigation, staffing pressure, family harm, than what the analytics investments we're talking about is going to cost. And thirdly, there is a political and public pressure for the NHS to finally close this gap in outcomes for any ethnic minority birthing people. So government wants measurable progress. We can't improve what we aren't analyzing. Since we have these resources, we have to use them. So the message is simple. With a modest investment, we can turn existing Embrace data into live intelligence that helps maternity MDT teams to act earlier and reduce preventable deaths. The data is already there. We just need to find the ability to use it.
Absolutely, that makes complete sense. So why do outcomes only indicators limit safety improvement? I know you touched upon that a little minute ago.
Outcomes only indicators like stillbirth, neonatal deaths, or HIV are lagging indicators. They tell us harm already happened, and some that we cannot undo, some that cannot be undone. So to truly improve safety, we must measure and monitor the processes that led to the outcomes. For example, how we escalate patterns, how we monitor the fetal monitoring processes and practices, documentation quality. This is something that we lack a lot. Continuity touch point, timely senior review. All these metrics are not measurable at the moment. So they foster a culture of retrospective review rather than proactive prevention. It also must variation in how care is delivered, make it harder to trust to learn from each other in real time, not after a year, not after all the investigation has taken place. Everything it has a time gap in between. So focusing on process alongside outcomes enable predictions, early interventions, meaningful learning that prevents harm before it occurs, so it won't happen again.
And how does the UK compare internationally?
The UK is strong in audit, surveillance, and perinatal review, but lags behind countries like the Nordics, Estonia, Netherlands, New Zealand in digital integration and real-time analytics. So many of those high-performing countries use national EPR systems with standardized fields and automated data extraction, giving the health professionals live access to safety information. While we rely on multiple vendors and inconsistent workflows, I would say, and a lot of retrospective data submissions, and that can delay learning. However, the UK's clinical leadership and national reviews, as well as a digital maternity focus, offer a unique opportunity to accelerate progress. So with stronger digital standardization, we can match international leaders in prediction-based and data-enabled care, I would say.
Okay, so why are we so inconsistent?
I think the inconsistency exists with the trust having so many fragmentation in EPRUs, and the systems conditions we ask midwives to work within are so different. So a lot of comes down to workforce pressure. In many places, midwives are entering the same information into multiple systems, which creates fatigue and increase the likelihood of incomplete or inaccurate data. There's also a huge variation in digital maturity. So some trusts are using modern EPRs with structured fields, real-time validations, interoperability, like lots of systems talking to each other, while others are relying on other older systems with limited functionality. So when the digital tools vary, the data inevitably varies too. And without national guidance on scoring system or mandatory validation rules, I think consistency becomes almost impossible. Another factor I would say is variation in digital leadership. So some organizations, they have quite strong digital midwifery roles, very defined roles, senior roles that they are part of the decision making, while others, they may not even have a digital midwife, for instance. So I think all these together, as they combine, they are contributing factors in this inconsistency.
So how can trusts improve accuracy and completeness then?
I would say they can make a huge difference to data quality by getting the basics right. So getting the basic rights in their digital systems and leadership teams. So when electronic records are designed with structured workflows, minimal free text fields, fewer duplicated fields, clear prompts, documentation become easier and faster and far more reliable for the midwives and the wider maternity teams. Real-time validation is also another game changer. If a mandatory field is left blank or the value doesn't make any clinical sense, the system should flag it there and then, not later, not after a review. So that prevents errors from being carried forward and increase confidence in the data we use for safety monitoring. But technology alone isn't enough. It cannot do magic. Education shapes behavior. When staff genuinely understand how their data feeds into safety surveillance, how escalation pathways and national systems like MSDS and MOS, all this engagement goes up and documentation becomes more consistent. So this is where the midwifery informatics roles are incredibly important because they bridge this gap. They bring clinical expertise with digital design, ensuring systems reflect real workflows and reduce burden. So I think this is the culture that we have to build in trust, culture of learning, not blame. Let's do it together. Let's see why we need to do it, where this will lead.
Absolutely, I completely agree with that. I'm going to touch on a little bit about that a bit later on as well, about the whole, national oversight. If midwives understand why it's so important to capture this data, they'll be more motivated to do it, I guess. But what national work is happening now, especially in digital maternity?
I think I have already repeated quite a lot of times the word standardization, and I think there is a serious big push on data quality and standardization, making sure every trust collects and reports information in the same way. So define the definitions and defining why we need this field and how we can translate this data. So that includes strengthening the national dashboards, updating digital maturity assessment, expanding AI-enabled triage pilots. I think this is where they're focusing now, and all this to be aligned with a 3-year maternity and neonatal plan. Also, the CNSD reforms a major step forward as well. So they are now placing a greater emphasis on data completeness, process indicators, transparent learning. All this together, I think they build a new picture. There's also a growth, I would say, a growing national focus on interoperability. So trust to exchange information and data within ICB, so within larger teams like regions and so on. So this is crucial because without joining enough systems, we can't achieve the level of visibility and early warning we need. As we mentioned earlier, this is what is happening in other European countries or worldwide like New Zealand. So all of these initiatives, I think, they're going towards the same direction, shifting maternity services away from retrospective and fragmenting systems.
That's so good. That's so nice to hear. That's really good to hear.
Hopefully we're going to see an outcome soon. That's the only thing.
Yeah,
How long is going to take expansion?
Absolutely, yeah, because then we can spot more trends and to see what's actually going on. But what would you like to say to midwives who are feeling sort of overwhelmed, by collecting all of this data and having so much documentation?
I mean, it's completely understandable that data can sometimes feel like an extra burden. But the reality, and this is what I think the message should be, the reality is that it isn't something administrative. It's not a burden that belongs to someone else. It's clinical. It's one of the most powerful safety tools we have. Every vital sign, every escalation, every CTG note, or any alerts we have, it builds a bigger picture that help us detect deterioration early, act before harm occurs, prevent any kind of risk. When documentation is accurately taken, timely and complete, it strengthens also the decision making for the whole team, not only midwifery led, but we have MDT teams. It provides the evidence base we need to secure safer staffing levels, to justify investments, as we said with Embrace. So where services are stretched as well. So good data doesn't just only support care. I feel it protects it. It's a protection for all the care we provide. There is something really important as well. Is a form of advocacy. It speaks for the birthing people when they cannot. This is what the data does. This is what they do. It draws a picture. It flags risks we might otherwise miss. It ensures the system listens to those whose voices are not often heard. So it's a tool of empowerment, I would say.
Yes, I love that tool of empowerment. So what national change do you think would most transform the maternity data quality?
It's what we discussed earlier, an oversight. So stronger national oversight, it doesn't mean bureaucracy. If it's clearly structured, it means doing the things well. So I would say starting with accurate reporting, making sure every trust means core safety process metrics reliably and consistently, real-time visibility, so building automated checks, flagging unusual patterns, and clear accountability and support. So when something appears and signal appears, an alert, the response should be rapid, proportionate, supportive, not punitive. So so as we mentioned earlier, it improves prevention, retention, people stay in an organization where they feel supported and not scrutinized.
Yeah, that's so important. And making the point of, again, understanding why they're collecting this data, and the fact that when trusts look at their own individual data, it seems so small. It seems so insignificant. But actually, when you take that across the whole country and you're looking at it nationally, it makes a huge difference. And I think that is like an education piece in itself. That's like a culture change, isn't it? To say that actually these small little changes that you make in your trust to improve a small amount of outcomes will actually make a huge difference nationally. So it's actually really, really powerful. You don't realise the impact that you're having when it's on such a smaller scale, if that makes sense.
Yeah, and that's why the training makes sense here, because if they understand how we can measure and compare and learn from each other, and when all this makes sense to the teams, this is where the quality, the documentation will shift and will increase.
Absolutely. So how should sort of maternity digital strategy align with the trust-wide digital strategy?
Well, maternity digital strategy must be integrated into the trust-wide digital roadmap. That will ensure alignment with interoperability standards, cloud strategies, requirements, CPR optimization. And I think we are in a much better position than we used to be in the past. So the last few years, I think the majority of the trusts, they do have that. And you cannot do the opposite really, because maternity services rely on corporate systems such as PAS, radiology. We have MDT teams, as we said. So by aligning the wider trust digital architecture with the maternity teams, we have shared data and enterprise tools and standardized workflows. So integrating planning with the trust-wide and the national NHS strategy is a key factor here.
And how should maternity strategy link to the NHS strategy as a whole? Because that's an even bigger sort of oversight.
Maternity digital strategies should be fully aligned with the national framework, such as what looks like a framework, national EPR convergence, NHS digital consolidation, and of course a 3-year maternity natal plan. Alignment ensures that the maternity data is comparable, as we said, measurable, that we can share with each other. So following national standards helps trust achieve digital maturity and reduce variations across regions, not only across like the trust within the trust or outside the trust, it's across the whole regions and the care setting. So by embedding maternity within national digital strategy, the NHS strengthens systems-wide learning and safety. So I think it's a key factor within the whole national NHS strategy.
And what does the role of leadership play in improving maternity data? Because this is a whole transformation, I think, as to how we can really improve maternity outcomes.
Leadership plays a far bigger role in maternity data and digital transformation than people often realize. This isn't just a technical challenge, it's a policy and decision-making challenge. And that is exactly what I'm exploring in my PhD, how midwives and nurses shape digital health policy and how leadership at every level influences what actually happens on the ground. So strong leadership sets the direction, the policy decision about how we measure, why we measure, how we measure, what we measure, and what good looks like. So without a strong leadership, the digital systems end up being built just around what's easy to collect. But what we need is what is clinically meaningful to collect and how we're going to collect it. Leadership translates also the policy into practice. And this is where digital midwives are absolutely essential, I would say, because they understand the maternity pathway end to end, but they also understand the digital systems behind it. So they become the people who interpret the national guidance and redesign documentation and make sure that data supports safe decision-making, clinical decision-making, rather than adding any noise or any burden. What else? I would say that leadership creates also the culture that makes digital change stick, because this is what it needs to change. And this is a big thing, to change the culture around it. So we can have the best policy in the world, but if the leaders don't champion data literacy and they don't protect time for training and model good digital practice, nothing really changes. And what we also learning through research, including my own PhD work, I would say, is that digital transformation succeeds when clinical leaders are at the policy table, shaping strategy, creating alignment between national priorities, as we said. I would say the national NHS strategy, local realities, ensuring the voice of midwifery is heard. So if we want safer, more consistent, and more equitable maternity care, we need strong, visible digital leadership that connects policy, digital tools, and frontline practice. And midwives, digital midwives are absolutely central to that, I would say.
So just to sort of wind up, I guess, there's going to be a lot of midwives that are listening to this now. What would you like to say to them to inspire them to, capture more data, feed in more accurate data, so that we can really improve maternity outcomes as a nation and prevent more baby deaths?
One takeaway, if they have to take one thing today, is that data, accurate data, is the power in your hand. It's what will give you the lessons we need to learn and how we're going to protect safer care within maternity services.
It's that important. It's that
powerful. And we have to do it together as well. All the maternity, the MDT teams, we have to learn from each other. And for the digital midwives, I would say, don't be afraid, be part of the leadership. Speak what you know best. You are the people, the key people, they have the knowledge, they have the power. Spread it, teach our colleagues.
Well, thank you so much, Georgia, for empowering us and inspiring us. It's absolutely fantastic. I know you want to give lots of support. You were one of the first sort of digital midwives in London, which is absolutely fantastic. So how can people contact you? Because if they want to learn more, if they want to ask you lots of questions, talk about digital midwifery or data quality, are you on Instagram and LinkedIn?
Yes, I can be contacted in either of these two, Instagram or LinkedIn. I'll be here. I'll be happy to help and mentor anyone that needs any guidance.
Wonderful. Well, you'll be tagged in this post and on our reel.
Thank you.
So if anyone is inspired and wants to contact you, please just click on the tag, and you can slip into Georgia's DMs and ask her any questions, and she'll be there to support you. Wonderful. Well, thank you so much for joining us, Georgia. That's been really, really insightful, and hopefully lots of midwives are inspired now to really look and understand at what they've got to do in capturing data. So thank you so much for joining us.
Thank you.
Fletcher Solicitors are proud to support the Mama Academy by sponsoring this podcast series. At Fletcher Solicitors, we champion better maternity care. For every birth, for every baby, for every family.
If you enjoyed listening to this episode, share it with a friend or colleague. Make sure you follow us so you don't miss out on our next episode. If you'd like to support our work by fundraising or volunteering, please email contact@mamaacademy.org.uk. For more information on pregnancy and maternity services, please visit our website at www.mamaacademy.org.uk. We're also on all of your favourite social media channels. See you next time!